Father Tom Knoblach. I'm pastor of Holy Spirit, St. Anthony's and St. John Cantius churches here in St. Cloud. Also serve as consultant for healthcare ethics for our diocese. Earned a PhD in healthcare ethics in 2003 from St. Louis University. So the position of consultant is available to healthcare institutions, parishioners, clergy, anyone who's interested in not only clinical ethical issues, but the whole complex reality of healthcare and Catholic teaching. About 8 years ago, the bishops of Minnesota, I also serve on the Minnesota Catholic Conference Committee on Life, Family, and Healthcare. And as there were initiatives in Minnesota in the legislature to introduce assisted suicide legislation, part of the response that the bishops wanted to make was not simply to voice their opposition to that legislation, but to realize we need to help people understand what is required, what Catholic teaching says about medical technology and the extension of life. And so through a series of consultations and a variety of drafts, the bishops wrote 2 documents. One is on healthcare directives, a Catholic perspective, about advanced care planning. So the bishops in their statement are clear that they support advanced care planning when it's appropriate, and not so much the instruction directive, which would say, if I have this condition, this is what I want and this is what I don't want, but rather the appointment of a healthcare agent, a surrogate or proxy decision maker who can speak in the moment about to the actual condition, prognosis, options for the patient, who cannot speak for him or herself at that time. The patient with capability or capacity, the legal terms vary, always has the right and responsibility to determine their own care. Advanced care planning comes into effect when there are a number of options and the patient is not able to speak competently for themselves, whether they have memory loss or some kind of cognitive impairment or are unresponsive. Those are the times when we wonder, what would that person want? How much would they desire? So advanced care planning is a gift to providers, to family, to say, now we understand what their values are. We can't foresee every possible prognosis, diagnosis, factor that might come into account. That's why a healthcare agent who can interact with the healthcare team in the moment is such great value. And that person should know what the person's wishes are, their preferences are, as well as be a person who can make decisions and take on that responsibility. Sometimes it's difficult when you realize the gravity. My decision will have an impact on this patient's length of life and perhaps how they end their journey here.